Well, we at the Yankee Institute commissioned a poll just focused on healthcare policy, and we fielded it last week. And what we found is that Connecticut voters have the same concerns about the national healthcare overhaul that Massachusetts voters just expressed at the polls earlier this week. We asked the question about whether you generally support or oppose the federal healthcare overhaul. By 51 to 34%, Connecticut residents said they oppose what they know and have heard about the national healthcare plan. 77% of voters said that they were somewhat or very concerned that the national healthcare overhaul would lead to greater deficit spending, higher taxes, and higher government spending. 61% described themselves as very concerned about those possibilities. We found that by 62 to 29%, Connecticut residents believe that Congress has rushed the process. They feel that Congress has been too ambitious, and they would favor more incremental reforms instead. People are also concerned about the expansion of Medicaid, potentially to be paid for by state tax dollars. By 49 to 26%, voters said that they oppose an expansion of Medicaid, if that's what it means. They were opposed to taxing health insurance policies by 77 to 9%. We didn't draw a distinction between so-called Cadillac health insurance plans and other plans, but clearly voters seem to understand that taxing health insurance policies is going to lead to higher premiums and higher costs.
Taxing benefits.
Sure. They also oppose taxing people who don't have insurance. This is the so-called individual mandate. It's included in both the House and the Senate versions of the bill. Connecticut voters said they oppose that 59 to 27%. They also oppose taxing businesses that don't offer health insurance by a margin of 44 to 31%. So deep skepticism among the Connecticut electorate about the big government approach to health care reform. I should point out that Yankee Institute is for change, we are for reform, we're just for free market approaches instead of big government approaches.
Did you ask how people, I know one of your questions was based on what you had heard or what you had heard already. Did you ask how they got their information? Did they read synopses of the bill, or was it from television and radio advertising and print advertising?
Well, if that language sounded familiar to you, it's because we borrowed it from Gallup. That's sort of standard language. That was right up the benchmark question in the poll. Based on what you've seen, heard, or read, are you generally in favor or generally opposed to health care reform? So it's a good barometer that you could compare Connecticut to other states.
So it could be everything, advertising and regular.
And that's correct.
And talk shows and everything else.
Yep.
Did you find dissension among Democrats that's been brought out that some favor health care, but they're not quite, they feel kind of disenfranchised or not pleased with some of the results that have come out from Washington?
You know, because we're a nonpartisan organization, we specifically try to steer away from sort of political impacts of it or the partisan angles of it. So I don't have crosstabs for you on that because we didn't look.
Well, thank you for availing yourself.